Because of the pandemic, people are not going to the emergency room when they actually should be, and it's turning into a deadly problem. Ray Preston has been talking with the head of the Barnes Jewish Emergency Room. Ray?
Yeah, he is also a Washington University emergency medicine physician, and he tells us that the number of visits to the ER has dropped by about 1/3. He says a lot of these people that should be going to the emergency room are not because of concerns about COVID-19. On a typical day before the pandemic, doctors would see about 240 patients. They're now seeing perhaps 160 to 180 each day.
And it seems people are afraid to come to the emergency department now because they think they will be exposed and catch COVID if they're not coming in for those symptoms.
Dr. Robert Poirier says each day about 60 patients arrive with COVID-19 symptoms, but others who need emergency treatment are often waiting too long before deciding to come to the ER.
People are dying at home. People are dying shortly after they arrive because they've waited too long, or they have permanent disability, especially if they had a stroke or a heart attack a few days previous and were afraid to come into the hospital to get treated.
He says if they're notified of possible COVID-19 symptoms from a patient that's on their way in, that person is taken in through a separate entrance. He says with 70 beds in the ER, they can protect those who don't have the coronavirus. Poirier says he's seeing people with strokes or heart attack symptoms waiting too long, only to come into the hospital days later and then die within hours.
People are just too afraid to come in and waiting days to see if it would get better, and it's not. If you're having major new symptoms, you need to come in, get it checked out. Don't be afraid.
And he says the ER is a controlled environment. It is not chaotic. He says they do have enough staff to treat patients appropriately. Now, when we ask him what he really wants people to know right now, he again emphasized that social distancing is very important. He also said that people need to control their medical conditions, especially hypertension and diabetes. Reporting live, Ray Preston, News 4.